have longer meetings, so. Well, thanks everybody for taking some time on another beautiful Michigan day, but real quick, brief update on what's happening in Lansing. I think most of us, or most of you have read, we did get the budget supplemental, the important piece of it done, which was extremely critical for a lot of the services that we have. We will be coming back in January and negotiating the rest of it, but the stuff that would have caused major shutdowns, we got that resolved and that's fixed. So I'm pleased to say that. We also have agreement that she signed, our governor on the state administrative board and the powers that they have there and moving money without any real reason into different pieces of the budget without making sure that those budgets are held harmless. So that's done. I would say, you know, critical to us was our small rural hospitals and some of those things that we were made sure that we got that funding. And then fortunate, how you doing?
Hi.
Haven't seen you in a while. Welcome.
Yeah, well, they're hard to get odd times like
Yeah.
this.
So, but anyways, we got that My Docs program, which was the educational piece, put back in, and so I'm pleased that because she was adamantly not going to support that, but after discussion.
Could you explain that a little more?
Yeah, it's called My Docs, and what My Docs is a educational reimbursement for doctors that choose to come to rural areas. And you know, it's been something that I've worked really hard on to make sure that we have doctors that decide to come into rural areas because they make less money coming to you know, a Frankfurt or, you know, now Traverse City's better, but you get to some of our smaller communities, because of the way the federal funding goes for a hospital, they're not allowed to pay a doctor the normal rate of what they can get paid in a Grand Rapids market or in Ann Arbor or Traverse City. And so what we've been able to do is a reimbursement program that if they come to a rural area that is actually rural and fits into that at risk, we can get a funding reimbursement for them. So it's kind of like a bonus to cover some of their student debts.
Is there a definition for rural?
Yes, there is a definition of rural would be under 40,000 people in a county, which of course, if you look at that takes, Leelanau is one of them, but we don't have a hospital here. But if you just go to Benzie County, we have Paul Oliver, and they're actually a critical access hospital, which means they're less than 25 beds. So they actually are on another piece that we had passed, and she hasn't agreed to that one coming back, but that's actually another funding reimbursement, but I think we'll get that back too. But so it's, you know, it's under 40,000. So anyways, we got that done. With that, I'm just gonna roll it into questions, and I see a hand went up real quick.
No, it's on the same subject. So I am a physician and I'm paying attention to this, and there is a shortage of physicians and physician extenders in this area. And, you know, so I'm really glad to see that it looks like that bill got passed from the Senate and is now in the House.
Actually, yes, that's the other bill that we're working, and that was a $5 million reimbursement piece for students that would actually commit to coming in, and it would be paid over a 10-year. I do believe that it is in the House. I thought that it had gotten.
It referred to committee, it says.
Yeah,
That was way back in September, so.
yeah, that would be right, because we voted it out of the Senate in September. So, and I know it's in the budget, but it was vetoed out. So I know we're working on it. She's waiting right now to see if it comes out of the House, and I do believe we will get that out of the House.
So a couple of things on that. So it seems from your previous comments that this has been going on for a while. Do we have enough data to see if it works?
The My Docs, yes, My Docs is actually a very young program too. It's only 2 years old. Last year it was full. And, so we know that it is working and it's bringing people in, but this next piece of it actually, I wanna be straightforward with how I wrote the bill, is that it was a 10-year reimbursement. So somebody can receive up to $25,000 for 10 years, so 250 grand. But the reason why I pushed it to 10 is we know that if a doctor or anybody affiliated with healthcare stays in the district over 8 years, they usually never leave. So that was part of the reason why I wrote that bill the way that we did, so that I don't want somebody to get reimbursed after 5 years and split. I'm trying to hopefully get somebody to stay and commit to an area, and then if they're young and they're single when they come, hopefully they fall in love and they stay, and we've got a doctor that's gonna remain in the area for a long period of time.
Yeah, so some of the other things that have been shown to be effective, though, is a lot of times when they get out of medical school, they are not single, they're married. Or especially if they get out of training, other postgraduate training, they're
Right.
married. So how do we, the spouse has a lot to say about where the doctor goes.
Absolutely.
So the spouse might be another doctor, the spouse
Yep.
might be someone that, so to pay attention to what is there for that spouse and what is there for their kids is essential. And also a professional satisfaction, they don't want to feel isolated,
Right.
especially if they just came out of training.
Correct.
So those are the things that, shared wisdom, how to get docs to come to rural areas. And now when we have so many, facilitated technologies that can improve, communication between
Right.
academic Mecca and here.
Absolutely, and that's a huge part, and that's why I use Frankfurt as an example. I mean, somebody moves to Frankfurt and they come in July, they see hundreds of
Yeah.
thousands of people, it's huge, but if you go there January 10, there's, you can roll a bowling ball down the main drag and there's nobody there. So you're exactly right, and that's just something that we're gonna struggle with. The START, I made reference to it, it's called the START rule, and it's a federal rule that the way a lot of these doctors can make their extra money is how many patients they see, et cetera. Well, they're never gonna hit those patient numbers in, Frankfurt, Michigan, or Grayling, or Gaylord. It's just impossible for them to do that. So that's part of the reason why we did these bills. Thank you.
Well, thank you for taking this on, because we really, really need some attention, especially since up here, we're older than the rest of the state.
Is that well?
And when you hit 50, you begin to need doctors,
Yeah.
more than you do before.
We need a lot of, and that's part of, that's part of what we have in the district, that I represent, is we have an aging district. We have more people moving in than are staying, our young people are moving out. And that continues to be a concern, and that's been part of the argument that we put is, we need to provide these services, and if we don't have people, and that goes to play with the CON package that we're working on right now, which is Certificate of Need, in our committee. And the way our medical laws have been written with the CON commission dictating where services can be provided. The law was written in 1973, federal was encouraged, but that we had a lot of small, rural, independent hospitals, and those were the reasons why it was put in, so that we could keep our little small local hospital. Well, over the years, we've all seen and I'll use Munson because Munson's the name here. The Munsons of the world have started to gobble up some of these small community hospitals, and what they've done is they have eliminated services from some of those hospitals and moved them to what they call their main campus. But none of those services can ever be brought back to the community that they were, because they own what they call a certificate of need. And so we have started to address some of that in our committee right now. And it is a major culture change, so you can imagine that has created quite the stir so far on the initial first week of testimony. But it's important. Right now, we need to make sure that we have access, that people can have those services without driving to, in some cases, all the way to Ann Arbor to get them from here. And we know what our weather can be like. So if we miss an appointment because the weather was too bad, it can be months before you can get back in and see a doctor again. So these are some of the things that we're working on. And they're not gonna be easy, and I understand that. But I do believe that it's time that we challenge the system for access to care and quality. I mean, the commission is always, it was put in place for three things. It's quality, access, and cost. Well, to me, access, all of us know what access is. We need to be able to do it. We expect that. Quality, to me, if you've got to drive all the way to Ann Arbor, that's not quality. And that increases the cost. And in some cases, it costs more money when those services are only provided in a few. But we also need to make sure that we just don't open it up, that we have all kinds of them, and then nobody can survive, and they start cheapening it up. So we're working on it. Healthcare is a major issue, and we'll continue to push forward to try to make some big changes there.
You know, people have told me if they have to go to Ann Arbor, they can't afford it.
Correct. Yep.
Because, you know, you might have to be there overnight, so
Yep.
where are you gonna stay?
Well, and I'll give you the perfect example was through a lot of work, we were able to override the commission's decision on CAR T-cell therapy, which is a new cancer treatment. And they were trying to limit it to the 4 main hospitals, 3 in Detroit area and 1 in Grand Rapids, and they would be basically never allowed to move anywhere else in the state. And I will tell you, this new cancer treatment, as it gets developed, it's expensive now. We knew that the decision that the commission made was actually going to increase costs, not lower costs. But the future of these new cancer treatments are going to will truly eliminate organ transplant. I believe that this new treatment will eliminate 90% of all organ transplants, because they'll be able to actually kill that cancer in the organ that's in your body without having to remove it and put a new one in, which in the long run is going to dramatically lower costs. So, but we need to be able to have that. If a Munson here in Traverse City wanted to be able to put that in, they need to be able to do that, because there's nobody from the UP that's going to drive down to Ann Arbor and be able to have this last stage of life treatment. So, you got a question here?
There's not organ transplant involved.
Pardon?
Why do you get the idea there's organ transplants involved? Usually there's not organ transplants for cancers.
Well, there can be.
Surgeries,
Well,
yes,
there can
but
be.
very rarely, very rarely.
Bone marrow transplant?
Oh, bone, well, now they do stem cell.
But I mean,
So,
these are
I mean,
the
it's,
things that,
But
but organ transplant through this will be, most of it will be eliminated through this CAR T-cell therapy. Eric?
A couple thoughts on what she was saying. She mentioned that doctors coming with spouses, and spouses looking for employment or things to do. With the internet now, there's a lot of opportunity. Problem is, rural areas don't always have internet. I know there's things going on at the federal government, anything going on at the state government.
State, yeah, we actually have a fair amount of money that was put in the budget for rural internet access. Met with the lieutenant governor on it here. Time goes fast, so it's probably been a month ago already, because he came and did a tour in the UP and all of a sudden realized, wait a minute, we got a problem here. I can't even get service. So we had a meeting with a lot of the senators that have districts that have a real problem. And we know that it's pretty critical right now. And the way some of the grants have gone federally, the way they're written, we actually, it's hard to believe, but actually the way that they were written, in most cases, it shows that we're meeting that standard, and we know that we're not. So, you know, we're doing a lot of work stateside to make sure that we free up right-of-ways, non-road right-of-ways, because road commissions have, you know, fought us on some of this. Because they don't wanna have permits going on, you know, but we are definitely working on that, and, you know, hopefully we will start making some serious progress. And, you know, fiber is always an issue. I mean, it's expensive. There's certain areas that we're not gonna be able to bring fiber to, but we need to be able to bring internet, economically, and not, you know, through some of these companies that are charging, you know, a ton of money for access.
The other thing you mentioned, or she mentioned, I forget, was keeping young people in the area after graduate high school and college. And there are two organizations in Traverse City that tackle that problem. It's TCU Tech Group, which is a once-a-month group that gets together to highlight new businesses.
Yep. The new technology.
And then there's 20 Fathoms.
I'm familiar with that.
20 Fathoms Incubator is a second floor space, corner of Front Park Street, downtown Traverse City. And they're an incubator for new business startups. And they've already had 2 or 3 or more graduate from that space and move into their own space. And there is a tremendous amount of activity, business-wise or manufacturing-wise, and technology-wise going on in the Grand Traverse region. When I was involved.
Absolutely.
I was involved in TCU Tech when they started up 5 years ago or so. And one of the first meetings, they handed out a list of 200 manufacturers in the Grand Traverse region. And most people went, what? They just don't realize that they're out there. And I've been involved in manufacturing for a lot of years, a lot of people there. What's that?
I'll look into that one. We'll take note of that one, but, you know, the incubator thing, you know, we've had that, through MSU Extension down in our area. It was housed in Oceana County, but it was the Region 5. So if anybody ever wants to see an ideal business that's grown out of the incubator, and you can get these chips at Meyer called La Fiesta. Everybody ever see that? Actually started as a incubator, and now they've grown and they're in Myers and they're all over the state. And they're probably one of our favorite tortilla chips, but that's a perfect example of what the incubator can do.
Success story here is great, like potato chips.
Yeah, absolutely, absolutely. What else can I answer? Yes, sir.
I'm just, I let you know last time I was here that I was really disgusted with the lame duck session on how the last legislative ended. I know you were representative then, Senator now. Is that anticipated this year? I know with the Democratic governor, thank goodness, she can selectively put the kibosh to it, but obviously last year it all flew, and it really disappointed me that that's how legislation was handled, that you were a part of it.
Well, understand lame ducks, if you look back in history.
Yeah, I realize that, but you're here now, and I'm here now, and that's why
Right.
I'm approaching.
There's been some legislation proposed that would eliminate some of that. Do I think that it's gonna happen this time, which would be next year? I hope not. I hope not, but knowing how, if you look at national and state, and, there's a lot of bills, we went through a little bit of a mini lame duck this week. And, you know, I mean, we wait until we're getting close to a break, and then they bring in some of these things that have been sitting in committee and been out of committee, and they're on the floor. They've
Well,
been
it's not funny, really.
No, but
Isn't- yeah.
I'm not saying that it's
Well,
funny.
I see reaction, and
Well,
it
I think
just is-
what we're saying, what we're smiling about, and what Eric, is that it happens, but you know what, we have, like some of those bills that we had last year in lame duck, they sat on the floor for 14 months.
Who was supposed to bring them up? Yeah, I
They
thought
have-
Republicans were in control
Right.
of it. Well, why wasn't it brought up in a
Well-
timely manner then?
That's a great question.
Yeah.
And I can't answer that.
Well, maybe we can start working to be a little more effective with our time and not try to jam it all in like that.
I'd love to be able to say that.
Okay,
that
well,
would
next
be-
time I'm back, maybe you will be able to tell me that, and I'll be glad.
You know what, I can probably tell you right now, probably can't answer that, because I'm not in control. That comes from the leadership, and that comes from the governor. And if they want a priority that they wanna move up there, and they see certain bills that they want moved, that's how it gets there, and our governor could make that choice all of a sudden saying, I want these 6 bills moved, what do I have to negotiate with you to get those 6 bills? And that's how that happens. And now we have a governor that she could make that decision, and it would be your governor, and you're gonna say, I don't like that bill, but she wants that bill.
I don't care about the bill. I'm just saying to do it in a lame duck session. That's entirely it, and it's not done right.
Unfortunately,
And it's a legislatively
unfortunately,
forward
I'm not
thing,
trying
that
to
maybe you ought to introduce some legislation to end it. Have you done that?
There is some introduction.
Have you introduced it?
No, I have not.
Okay,
I
why?
mean, because it's already been introduced, so why do you can't
Where is
reintroduce
it
the same
moving?
bill.
Where is it sitting now?
It's just sitting in committee.
Have you co-sponsored it?
No,
Do you know the bill number?
I do not know the bill.
Any move on transparency in this state? I know we're probably pretty much rated last and all the way through government, courts, everything else. Any move or bills with transparency?
I believe that the House has a series of bills, I can't tell you where they were, as you know, I voted for it, I had a bill in that package 2 years ago.
I think I did be all last.
So, you know, I've never had a problem with transparency, I came from county government, I don't have an issue.
What do you think the hesitancy is? Because it's Republican hesitancy. What is
I
the
don't know,
Republican
I
hesitancy?
disagree with you on that,
Oh, do you?
I do.
What Democrat has ever voted against transparency?
That's a great question, I would have to look on what those bills were, and we can
Maybe you
look that
can
up.
search that on your computer.
I'm sorry, what, exactly which,
How many Democrats have ever voted against any transparency bills in this state?
I could get your information, it would probably take a while
Oh,
to
well,
look
that's,
up
that's
ever.
fine, you have
We
it.
can pull it
Go
up,
ahead, yeah.
But,
we
yeah,
can pull it up.
Okay.
I saw, let me get back, you had a question.
Well, I'm always wondering if the state will ever come up with a septic code. And I know, I don't know why it's political, the septic code, because to me, we all have to drink water.
Yep,
So I really would love to see some movement on that.
well, here's how I'm gonna answer that. Because we went through that, and as you know, I voted against it last year because there was no funding piece tied to it and what the cost is. Now, we have a major difference in our soil makeups throughout our state. So a uniform septic code can be almost nearly impossible to write a general code for an entire state. Now, we've encouraged that.
But every other state and nation has.
Every other, you know, if some do, some don't, and I do agree that we got some work to do, and we are working towards that. You know, I chatted with a group over at Higgins Lake earlier this year, and I said, I have no problem supporting a septic code. However, we've got to write it to a point where we don't burden a county with a code that puts the county at risk of owning properties because people abandon them. Because who pays for that? That's extra money that comes out of your county government. Right now, the bill that was proposed last year would have put a burden on every county of somewhere around $250,000 that each county would have had to pay. That's without any forfeitures of property. So any forfeitures of property then would become the responsibility of the county fix. And the way, that's why I voted against that last year, because you have 28,000 people in Leelanau County. That's an extra $1,000 a household that they've got to collect in tax. And that's without a forfeiture. Every forfeiture to redo a septic system is another 10 to 20 grand that all of a sudden you, as constituents, have to pay. That's where we came. You know, right now, we're working on the lead and copper rule as a state, millions and millions of dollars we're paying to help pay for that. So that, until we we can figure out how some of that funding goes, that's where my hesitancy is. And I'm gonna ask everybody in this room, who's willing to kick in an extra grand a year in taxes for a countywide septic code? Okay, two out of the 10. So now you but you have the money.
No.
I'm gonna ask
Is
you,
the money now, or what happens?
well, I understand, but here's where I go. You have the money. What happens to the person, and we want young people to remain in our county, if we're charging an extra $1,000 a year in tax, that young person can't afford that. We can't afford, a lot of them can't afford it right now because we don't have workforce housing in the district that we're trying to help and get standards for. But you know, this is the picture of what we've got to be careful, because it can be fine for you, but you want to talk about an age discrepancy that could happen. That's what I want us to look at, because somebody that's 25, and we remember when we were, well, I don't really remember 25, but I know I was scraping to survive at 25. If we put an extra burden on them at 25 and they go, boy, I can go to Grand Traverse County and I can drive in, or I'm already driving there, maybe I should just live there. We can't afford to lose another young person out of the county. So those are the reasons. There's lots of things that go in, and it's not as simple as just saying we need to have this code, because the way the bills were written, that's what it would have done to our 83 counties in the state.
Well, as a kindergarten teacher, you know, every year I got, when you did the split, you know, 56 kids. And I had to teach all 56 kids depending on their level. I wasn't given just one code that everybody, so it seems to me we could definitely have scientists who are smart enough to figure out this county has this land, this soil, so this is what they need. I can't believe that scientists.
Well, I do believe we can get there. I do believe we can get there. I'm just saying we're not there now, and nobody's brought that bill there to be able to make, you know, to do a statewide code that works for all the counties. Yes, sir.
One of the problems with a statewide code is there's no definition of what is a failed septic system. And two, there are no qualifications for who is an inspector. And if the inspector doesn't like you, can you fire the door? And the other problem is, the bigger problem is abandoned wells. Now,
Well, that's the burden that the county would have to pick up.
I lived down in Kalamazoo County, and I sold my house, I had plugged a well. And I had only owned that house for a year and a half, but in that year and a half, they passed that
Right.
abandoned well law. And
Well, and we have several counties that have had the septic code, and we now have one that's trying to disband out of their group because they can't financially hold it together. And which now they're being challenged downriver from that, because, so, I mean, we gotta figure it out. You know, I mean, we all want clean water, and I think we all want a clean air, and we wanna make sure we are good stewards. But we need to make sure that what we do doesn't put us into a point where it bankrupts a county, because we can't afford to do that either. And we've gotta make sure that what we do is right. I saw a hand up over here somewhere, I thought. No? Okay. Yes, ma'am. I'll grab you next, sir.
Thank you.
This might be quick, but I had heard there was some legislation that would make people who run, how to put this, for township office to be nonpartisan. Do you know anything about that? Can you talk about that?
You know what, I don't know about that. I guess I know that there was a bill introduced that would change some of the terms so that they wouldn't be 2 years, that they would be, and then they would split them and alternate every 2 years, so that we didn't lose. But I don't know about nonpartisan. I believe that, I'll have to look into that. I don't know.
Define nonpartisan.
What?
Define nonpartisan.
Well, they wouldn't run as, you know, from their party, they would run as them.
We can't even have a sheriff run nonpartisan.
Good.
Well, they don't. That's the sad part. They shouldn't be partisan. But until that changes, I can see how that would.
But I just heard there was legislation afoot. So I just.
Sir?
Yeah, I'm
Thank
here.
you for being here, by the way.
I apologize for being here late, I just realized that it was starting at,
Not a problem.
9:00, so thanks for coming out here to
Absolutely.
address some questions. What I'd like to hear is your perspective on the changes related to the no-fault insurance laws.
I'm excited. I'm excited to see that we finally have a change that, is gonna save the drivers here in the state of Michigan a considerable amount of money. And, you know, I think that there's some folks that'll say, I think it was terrible that we did it, but ultimately, it comes to a point that our insurance was, causing a burden on drivers, and we had more and more drivers that were choosing to be uninsured. That was part of the reason why our costs were considerably higher than other states. And, we are still the highest state in the nation when it comes to, the levels of no-fault coverage. But unlimited was non-sustainable. We couldn't continue to pay unlimited. It was gonna come to a point that nobody was gonna be insured.
You know, I'm here because, you know, I wanted to, you know, seek first to understand and then to be understood. And, you know, and I'm trying to hear what the other side of the story is, because, you know, what I'm hearing makes me very, very concerned about what the change is. I'm myself personally a survivor of, you know, a real tragic auto accident. 26 years ago, I left my wife with traumatic brain injury. And everything that I'm hearing since that law was passed, and I didn't even realize, you know, it was under consideration. When I talk with people and ask the question of friends and so forth, nobody even seems to know anything about it. And, you know, I've talked with different attorneys, I've talked with the different agencies in the medical arena that, you know, address the kind of needs that people that are accident survivors, you know, require, like us, down through all these years. I've heard different radio talk show hosts. Steve Gruber is one from down Lansing, and some others who've even had CEO from Munson Hospital talking about it, that it's going to eliminate like 15,000 jobs in the state of Michigan in the medical arena. It's, you know, basically going to drop the fees of the people that provide these services, so that, you know, they're probably going to be driven out of the state of Michigan. I'm not even sure that I'm going to be able to have those kind of resources available, you know, to me going forward. I've talked with attorneys, and, you know, and even under, you know, what is considered the best in the state of Michigan as far as a model for the kind of protection.
I think you and I probably need to have a sidebar, because it'd take me hours to explain it to you.
Well, I'd love that.
And I'd be willing to do that, but I'm gonna give you a couple things first. Number one, your wife's a survivor, and I'm assuming that you had insurance also.
Yeah.
Okay, which you would have been covered, by the way. You would have been covered. Perfect example, and I'm gonna use it as my personal family issue. My son had the same sort of accident, but it wasn't involved with an auto. Okay? And my son is doing very well today. Now he has long-term effects because he lost vision from the accident. But he wasn't left by the roadside like a lot of these organizations want to let you know, or try to tell you that. The other piece of it is that our hospital systems and some of these specialties under our no fault had no cap levels on what they charged. They could charge you anything they wanted to charge, and there was no fee schedule. So a perfect example is an MRI. normal person that has personal insurance pays, you know, $600 to $800 for an MRI. The average in an auto accident was over 4,000. So I mean, this was the cost that we were putting in, but I will tell you that I can hear all the negatives, and I will tell you every lawyer probably does, and if you're a lawyer, I apologize.
No, I'm
But
not.
they were making lots of money representing people that were in accidents.
But the people were getting lots of care as well.
And they're not going to not get that now.
Well, it's good.
And that's the argument that I will have. But the other issue goes to this. 26% of the people in Leelanau County right now are driving uninsured. That's a true number. You get into Wayne County, Oakland County, Macomb County, we have 50% of the drivers that were driving uninsured because they couldn't afford it. So what we are doing is we are forcing people to make decisions, to either be criminals and drive uninsured, or make other choices of not paying the rent, not putting food on the table. And I think there's a lot of arguments, but I look at certain organizations that I had plenty of discussion, and I have a relative with one of them. And what's very interesting is these organizations have their same organization under a different name in a different state, and they're operating perfectly fine in providing care and access to care to people that have been in accidents or through this. But I will say this, they're not making the profit that they were making before because there was no set limit on how it works. But it's a very, very touchy subject that a lot of people had. I understand what we gotta look at.
Well, I would love to have, a conversation.
I would be
with
glad
you,
to do that.
Because, what I'm understanding is, in terms of the attorneys, it's going to go more to the tort law kind of a scenario. And as far as people that are out there that don't have insurance and they hit me and, and cause an
Right.
accident, then there's gonna be the kind of problem that I'm gonna face with trying to get the kind of coverage that I need. Whereas before, it was my insurance that I was paying for, that I had the protection. And now, people are gonna have to have, I've got a high liability umbrella coverage and I can afford it. A lot of people don't have those kinds of things, so it's gonna drive.
Remember, people have the choice of what level of coverage they want to take today.
Yeah, but there's issues even in that regard, and, so if you can answer the kind of questions that are being raised by the people that are.
I'd be
concerned
glad,
about it.
if you put a list together, we'd be glad to make
Well,
time to come up.
The list has already been created by CPAN, the coalition that's,
Well, CPAN in what, they're always gonna fight for that because they're fighting for the provider that makes a lot of money.
Sure, and I understand
We've
that that's
gotta
probably. an issue
remember,
that needs to be
we've gotta
addressed.
remember that there's two standards in life. You know what, you got the one that wants to make all kinds of money, that says they're advocating for you, and in reality, that's not what I believe they were trying to do, and what I say is, okay, why did the 49 other states